be on the
Well,
website.
you wanted chit-chat.
Would you got down to children's, what, in the late
1979.
Yeah.
I don't know if you remember this, Steve, but you know, I started the developmental center back then.
Right.
And the first guy I hired as a psychologist was a guy named Glenn Blowitz. Do you have any recollection of him?
Yeah.
He died yesterday.
Yeah, Debbie Braden told me about that. I
Really?
didn't know.
Thank you for visiting the Baby Sharon Fund of Arkansas website. My name is Richard Emmel. I'm the chairperson of the fund. With me today are committee members Dr. Patrick Casey, Carol Maxwell, who is our liaison with Children's Hospital, Mark Pearson, and Steve Reed. Not with us today is John Marcheski, who had a prior appointment. I'd like to start by asking Carol. Carol, would you tell us about how a family goes about getting help?
As a social worker at Arkansas Children's Hospital, I'm in the position, along with my co-workers, to find families who are in need of extra help that they cannot get through the normal channels, such as through Medicaid or their insurance company. Examples would be equipment needs that are not met by insurance companies, or a home generator for a ventilator-dependent child. So we gather information, and I represent our staff and bring these cases to the committee. And as a non-committee voting member, I present the cases and we discuss whether this is an appropriate need or not. The committee does its due diligence in asking the appropriate questions about our families and whether these situations really warrant this kind of help, or what other resources are the social workers finding for families. So I feel like the committee has done a great job over the years, helping well more than 100 families from our hospital, and we hope they will be able to help other families too, if social workers at other hospitals will also make referrals to this committee. So far, there have been probably almost $100,000 worth of help to our families who were in such crisis that they didn't know where they were going to live or how they were going to get their child to appointments, so it's been an invaluable resource to us. There is an application on the Baby Sharon website that can guide an applicant on what the committee needs to present for the hearing, and I'm always glad to help anyone.
Thank you, Carol, for letting us know what a family would do and they needed help. And now, Dr. Casey, would you tell us a little bit about what a family goes through if they have a child with a catastrophic medical illness?
Sure. Well, I've been a pediatrician at Arkansas Children's Hospital for almost 35 years, and an interesting phenomenon has occurred, which is a good thing, in that because of the improved quality of medical care and surgical care and support care, the number of children who die from serious illnesses is much lower now than it would have been 25 years ago. So there are now children who go home with multiple diagnoses requiring extra special care at home, and who have to come to our hospital on many different occasions to see multiple doctors. There are children who literally will have 8 to 10 diagnoses, who have to go see 6 or 7 doctors at Children's Hospital. They may have a ventilator, meaning they have a machine that helps them breathe. They may get fed through a stomach feeding tube. All of these presents considerable burden to the families, both emotional and physical, but also financial. Many times, and we know this from research, that families who have complicated children like I've just described have to pay out of their pocket much more for health care as compared to a child who doesn't have those. So it's great that at Children's Hospital that we have the opportunity to access the Baby Sharon Fund to help families with relatively small financial burdens, but can be a great relief to them. So we really appreciate this.
Thank you, Dr. Casey. You might be interested in a little bit about the Baby Sharon Fund itself. Now, there's a brief paragraph or two about the history of the Baby Sharon Fund, but I just want to tell you about it. Back in 1993, we had our youngest son, diagnosed with cancer. I didn't know that. I was teaching, and I bought an insurance policy, a health insurance policy, to save $8 a month. And one of the things on the policy was that it had a $1 million limit. I didn't even think about that as remotely as even being possible. And also there was a 1-month waiting period. Roughly 5-6 weeks after that, our son got sick and Eventually, we found out it was cancer. And we had 2 years of dealing with it, in which time we used the entire $1 million and more. And then we had to make a decision on another medical treatment that was going to run upwards to $500,000. So we were fortunate, and I believe even Miss Carol helped us actually, and sitting here thinking about it. So we didn't go what's called medically bankrupt. Now, fast forward to the year 2000, and our first grandchild was born, named after my wife, Sharon. Unfortunately, she was born in Ho Chi Minh City. And for 2 weeks, we had a lovely little baby girl, healthy, appeared to be healthy, and then we found out that she had, well, we didn't know actually. We were sent x-rays, or the doctor here in Little Rock was sent x-rays, and the diagnosis was that she had a coarctation of the aorta. The aorta is, right after it comes out of the heart, feeds the rest of the body, and it's like having a rubber band, a tight rubber band around it, so the blood can't get to the body. We found out surgery was available. We got it worked out at Children's. We had the plane ticket, we had everything taken care of, and then we were told that we had to give the government of Vietnam $35,000 cash. Couldn't be credit, couldn't be anything, had to be cash. We didn't have that money. It took us about 2 weeks to get enough money. By that time, she couldn't leave, she couldn't come to the States, and so we arranged for surgery in Bangkok with the Mayo-trained doctor. The surgery went well, but she died 2 weeks later, complication with tubing, as we were, best we understand. Through this whole process, we were talking with people and with interpreters. So there was really no way to have a firm understanding of what was happening. So we've experienced that twice, our family. And in 2000, I approached Jeremy Hutchinson, who was my representative at the time, and told him about the 2 incidents, and we fashioned a law, the Baby Sharon Fund, and it became law in 2003. It passed both the House and Senate unanimously, and you now can make contributions to help families like Carol's talked about, like Dr. Casey's talked about. You can do that on your income tax with a simple checkoff. And of course, you can also make direct contributions. So I thank you again for coming to this website, and we're here to talk to you about getting help, but we also are going to talk to you about helping others. So Steve, would you talk to us about giving to the fund?
I've had the privilege of serving on the Baby Sharon Committee for about 3 years now, and there are 3 things that always pop into my mind when I think about the committee. One of them is the folks who serve on this committee and how hard they work. And another 2 points that are probably very predominant. One is that there's never enough money. Regardless of how generous people are, the need is always going to be greater than the funds available to meet that need. Carol does a great job in sorting through, I don't know how many applications, to come up with a few that she thinks will have the biggest impact if we're able to fund them, and the others just don't get addressed. So our goal is always to meet the need the best we can with the limited resources that what we have. Another point that is important is that I've been in philanthropy my whole life, my whole professional career. And there's almost no charity that devotes 100% of its resources to the purpose for which it is formed. This organization does that. Very important. Even the large charitable organizations that you contribute to, that we all do, they have to spend 20 or 25% of that on fundraising and administration. We spend 0 on that. It's not uncommon for the committee members to pay expenses. We don't have a budget. So the idea is that 100% of any gift goes directly to that family who really needs it. And these are not needs that are easily met. These folks, they need a car so they get their child to the doctor. that need a ramp so they can get a wheelchair access into their home, and they don't have any funds to do that with. So whether or not their request is funded has a material effect on their life. So I'm happy and proud to serve on the committee, but it's so frustrating knowing you're never going to have enough money to meet the need. So if you contribute to the fund through the website, maybe one more family will have their needs met than we can do right now.
Action.
Thank you, Steve.
Wow.
So Mark, would you talk to us about just what happens after we make a grant and what happens then?
Certainly, Richard. Once the committee approves the cases that Carol brings before us and we approve the funding, I then send a disbursement form to the state of Arkansas to a gentleman named Richard Drilling. He's a physical accounting manager for the Department of Finance and Administration. They keep a trust fund with all the Baby Sharon Committee funds in them, and he writes a check to whatever entity it needs to go to. The money never goes directly to the families we help. We always pay it directly either to a hospital or a contractor or a store where we're buying the things that the family needs that are not paid with normal medical insurance. The funds are always kept track of. If you want to, there's actually a spreadsheet on the website that shows the receipts we get by month and the expenditures that we make by month. As stated earlier in the video, you can contribute through your Arkansas state income tax return with just a checkoff box. So as Steve related to you, 100% of the funds go to help needy families, and they're vetted before we give any money to any purpose for these families, and it's for anything from, like Carol said, a generator to run a ventilator when the power goes out, to buying cars to get the families to the hospital. So thank you for watching our video.
Again, thank you for visiting our website. Thank the committee members for this special meeting. I do want to remind you, if you're looking for assistance, that the grants can be made only to patients seen by an Arkansas physician or recommended by an Arkansas physician, and also you must be 18. So those are and this is on the website. Visit the directions are on the website, and also you can always call Children's Hospital's social work department. And I'd like to thank my son Joseph Emmel, who did all the camera work today, and God bless you. Amen.
Amen.
Thank you, guys.
We had
Thank you.
today at lunchtime, the reason I'm
Thanks,
dressed up
Joseph.
is we were at the
I thought you were only dressed up for this.